Hello, this is Dr. David Greene, CEO of the Florida Pain Network. Today's topic is what you need to know about spinal cord stimulator implants. The spinal cord stimulator is a revolutionary device. It's permanently implanted around the spinal cord in an effort to provide pain relief to those suffering from chronic pain. It can actually work well for either chronic back or leg pain, and it's an excellent last resort treatment because it does involve surgery. It's very expensive for the insurance companies, and it doesn't fix the problem that you're experiencing, but it can mask it very well. Now, who benefits? It's not a first-line treatment. It doesn't fix the problem, but if you're suffering from failed back or failed neck surgery syndrome, postlaminectomy syndrome, RSD, CRPS, diabetic or peripheral neuropathy, and there's increasing indications for such things as testicular, pelvic, abdominal pain, all those can benefit. What it can do is it can take a person who has chronic pain, depression, and an inability to work, and it can turn their whole life around. It's been shown to work well, as I said, for back, neck, arm, and or leg pain. You have to have a trial placement first, which is a low-risk outpatient procedure. This is an excellent last resort option when surgery just isn't indicated to fix your problem, and it can definitely decrease the need for narcotics. So the first step is a trial implant. Okay, it involves a percutaneous placement of 1 or 2 leads. They're tiny. They go from inside the spinal canal to outside the skin, and there has a sterile dressing placed, and then it's attached to what you see here, which is a battery pack that acts as a programmer. It's placed by the pain doctor under sedation so that the pain doctor can ask coverage questions like, you know, does this cover the area where you normally have your pain? Yeah, they have to know before they, you know, stitch it into place. And it's worn for 5 to 7 days to see if it's going to work. If it provides over 50% relief, that's considered a success, and the patient will move on to a psychological evaluation, which is necessary prior to getting the final placement. So the final implant is completely under the skin. It takes about an hour to perform. It consists of a large paddle lead for better coverage. I'll show you that in a moment. The physician, whether it's a pain doctor or a spine surgeon, makes a small incision in the bony area over the spine called a laminectomy so that the large paddle lead can go underneath. And then the electrodes are tunneled under the skin subcutaneously, and the battery pack is then placed either above the buttock area or around in the abdominal region. The new ones have an immense amount of programming options available, over 200, and they are rechargeable through the skin at night while you're sleeping. And the newest ones don't lose coverage as you go from a sitting or a laying position to a standing. That was a big problem with the old ones. So here you see what a paddle lead looks like. It has a lot of diodes on it, and that's one of the reasons you can have a ton of programming options. Numerous studies have been done on the effectiveness. 84% in a St. Jude study had a great life improvement. In this one, 77% had good to excellent pain relief for either back or leg pain. There was one done recently for diabetic neuropathy and showed that 58% experienced substantial recovery of sensation, and over 3/4 have significant pain relief. And for RSD, spinal cord stimulator works extremely well for pain relief. You can see how small these battery and programming units are now. That's a quarter. Look how small they are. It's great. What are the risks? Well, one risk is that the device may stop working. Okay. One of the benefits of having over 200 programming options, if that happens, you can change up the programming. One risk is that the lead may migrate. There's a potential for infection and some bleeding and possibly some wound breakdown. You know, it is kind of a decent-sized device going subcutaneous. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state participating, accepting over 50 insurances and providing over 25 different treatment options with the physicians involved. In the Tampa area, visit us online at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Greene with the Florida Pain Network. Your pain stops here.